Hello, my name is Anna Latka, and I will be conducting an oral facial exam with my sister, Katarzyna Latka. She is 19 years old, and first thing we're going to check is the symmetry of the face. And she has a normal symmetrical face. There's no abnormal movements, and she does not breathe through her mouth, she breathes through her nose. Next thing I'm going to do is ask Kathy to open and close her mouth. Okay. The range of motion is normal. The symmetry is normal. There's no drooping, and the movements are normal. And there are no noises at the temporal mandibular joint. All right. Now I'm going to ask you to show me your teeth. Okay. And Kathy has a normal occlusion, but she does have a slight overbite. And her teeth are all present. She doesn't have any missing teeth, but they are slightly crooked and slightly misaligned. Right, and her hygiene is good. She brushes her teeth 2 times a day. Right, now I'm going to ask you to pucker your lips. And her range of motion is normal. Her symmetry is also normal, and I'm going to ask you to press against this. And the strength of her lips is also normal. All right, now I'm going to ask you to smile. All right, and her range of motion is normal, symmetry is normal, and when Kathy smiles, she does not show her teeth. Now I'm going to ask you to puff up your cheeks. Okay. The lip strength is normal, and there is no nasal emission. I'm going to ask you to open your mouth. Okay. The surface of the tongue is normal. The color is normal. There's some slight jerking movements. Her tongue isn't completely still. But the size is normal, and if you could lift up your tongue for me, lift it up to the top. And the frenulum is also normal. If you could just stick your tongue out for me. Thank you. The excursion is normal. The range of motion is normal, and when I asked her to stick out her tongue, she stuck it out in a timely fashion. Now I'm going to ask you to use your tongue to press against this, and strength is also normal. Open your mouth, stick your tongue out, and put it back inside your mouth. Keep your mouth open though. Stick it out, and stick it back in. Very nice, thank you. The excursion is normal. There is no deviation, and the range of motion is also normal, and the speed at which she put her tongue back in her mouth was also normal. Now I'm going to ask you to stick your tongue out and move the tip to the right. Okay. Again, the excursion is normal, the range of motion is normal, and if you could just stick your tongue out again, stick it to the right, and press against this. And she also has normal strength. Now if we could repeat that again, but this time stick your tongue out to the right. Okay, and press against this. Right. Again, the range of motion is normal, the excursion is normal, and the strength is normal. Now if you could stick your tongue out and stick it up. Okay, and the movement is normal, the range of motion is normal, and it is interesting to note that Kathy can touch the tip of her nose with her tongue. Okay, now if you could stick your tongue out and stick it down. Okay. The movement is normal, the range of motion is normal as well. Now if you could rapidly move your tongue from side to side. Okay. The rate is normal and the range of motion is normal. She's able to maintain a constant rate until exhaustion. All right, now if you could just open your mouth wide for me. Stick your tongue down. Okay, I am examining her pharynx, and it is a normal color. I can see her tonsils. They are normal as well. And now I'm going to ask you to open your mouth again and tilt your head slightly back. And now I am examining her hard and soft palate. The hard palate is of normal color, but the soft palate has a slight yellowish tinge to it. but there is slight rugae posterior to her front teeth on the alveolar ridge. There is no fistula, there is no cleft. The arch height is normal, the width is normal, and there's no growth. There are no growths, and symmetry is also normal. Now, Kathy did decline to have a gag test done. She's very uncomfortable with vomiting, and I respect her as well as any patient's decision not to participate in something, so we are gonna move past that. Right now, I'm gonna ask you to open your mouth and say ah, ah. Say it one more time. Ah. Okay, and as I'm looking in Kathy's mouth, there is normal symmetrical movement. The posterior portion of her tongue does move as well as the lateral portions of her tongue. And her uvula is normal. Okay, Her uvula is normal, and there is no deviation, and it is not bifid. And say again. While there is some slight nasal emission, I would consider it to be very normal. So overall, Kathy has a normal oral facial exam. And it is interesting to note that the yellow coloring of the soft palate, as well as the fact that she did decline a gag reflex, which I think is okay because not everyone is comfortable doing everything. So that concludes the exam. Thank you very much, and thank you, Kathy.
Yeah, you're welcome.